Hi, today we want to talk briefly about the prevention of back pain. And once again, we're going to talk about exercise because it's a known fact these days that if you suffer from back pain, and 30% of people listening to this video would be suffering from back pain, and most of us, 80% of us, have had an attack of acute low back pain at some time in our life. So if you're suffering from back pain, exercise has to be a key part of your treatment program, and it's basically your self-management program. If you've never been given exercises and you suffer from back pain, see a health practitioner and ask for a good program that is tailored to your needs. There's three reasons. Number one, exercise builds muscle, and muscle controls the spine. It protects the spine. What type of exercise? They did a very interesting study where they took one group of people doing aerobic exercise only, and that's walking, swimming, cycling. The other group did aerobic exercise plus strength training, or we also say resistance training, so weights. Well, the results were outstanding. After a year, the cardiovascular or walkers or aerobic exercisers showed a 2% increase in cardiac capacity, 2%, and they showed a 15% increase in endurance. But interestingly, the people who did the weights plus the aerobics showed 9 times that. As a matter of fact, their endurance improved 109%. Then they measured strength. And the people who did aerobics only, walking, swimming, cycling, showed no increase in arm or leg strength. But the people who did weights showed a 22% increase in arm strength and a 40% increase in leg strength. Why is this important? Because the second point is muscles deteriorate as we get older. And this is scary. Between the age of 20 to 40, women lose about 3.5 kilograms of muscle mass, and they gain 10 kilograms of fat. Ooh. Men, between the age of 20 and 80, lose 1/4 of their muscle mass. And this is part of the aging process. So if we expect to get older and stay strong, we must address our muscle content. We lose muscle fiber, skeletal muscle fiber, as we get older, and it's tied up with all kinds of diseases, heart disease, diabetes, and becoming frail. So it's important. Muscle burns fat. You build up your muscle using weight training, resistance training, properly instructed, and you'll burn fat and decrease that fat percentage in your body. Fat is inflammatory. It has negative effects on the heart. It leads to all types of cancer. It actually damages cartilage. So decrease the fat stores. Number 3, 14 countries, they chose weightlifters, and they compared them to people who don't lift weights at all, and the results were outstanding. They looked at bone density, and they found out that these guys and women had 40% to 50% stronger bones, and of course they were 50% stronger. But then they replicated the same study with weights in young women, and they found an increase in bone density. And then they took elderly women in the UK for 1 year, 3 weight training programs a week. These are elderly women, and they found at the end of the year that they had an increase in bone density and strength of 20 to 30%. When you think about it, these elderly women were actually getting younger during the course of that exercise program. So the key to the prevention of back pain and to living longer and living stronger is build muscle mass, properly instructed with a health professional. Ask for instructions and get some advice. To make sure you get our weekly videos via email, go to the subscribe page or use the link in the description. Another great way to get our video updates is to follow us on social media with the links below. And thank you for watching.